Hi, my name's Ted Parks. I'm an orthopedic surgeon here at Western Orthopedics. I thought we'd spend a few minutes talking about hip replacement surgery. So in a hip replacement, the problem is that the cartilage, which typically protects the surface of the ball and the socket of the hip joint, has worn away. Cartilage is an ideal bearing surface. It's slick and numb, and that cartilage surface coats the surface of the ball and the surface of the socket. In arthritis, the cartilage surface is damaged or worn away, so the patient with arthritis in their hip rubs a surface of the ball which is raw and exposed bone against raw and exposed bone on the socket side of the joint. The purpose of the hip replacement operation is to resurface those areas with metal and plastic, or perhaps ceramic and plastic, and those artificial surfaces are slick and numb the way the cartilage originally was. Typically, the factor that leads to a total hip replacement operation is pain. An arthritic hip is typically an uncomfortable hip, and as time goes on, that discomfort gets more and more serious until it finally limits your daily activities or interferes with sleep. At that point, a patient with those symptoms is an excellent candidate for hip replacement. The hip replacement is a good operation for eliminating the pain and functional disability from hip arthritis. Most people who have the operation have found that they've been limited by arthritis and want to get rid of those limitations. The hip replacement does a good job of that by eliminating pain and increasing function. The hip replacement operation takes about an hour. Plan on being in the hospital for 2 or 3 days, and then being discharged either to home or, if you need to a rehabilitation facility. After surgery and after discharge from the hospital, most patients use crutches or a walker for 2 or 3 weeks, and then after that a cane for 2 or 3 weeks. After that you may limp for 2 or 3 weeks, but then after that you should be able to walk with a normal gait. I hope that was helpful for you. If you want to learn more about hip replacements, visit our website at western-ortho.com.